Hello, good afternoon. I'm Dr. Singhal here, and I'm sitting at the hospital, Ashlok Hospital, a nursing home in Southern Enclave. A little background about myself. I'm a general surgeon by profession, and I'm in Delhi for the last nearly 49 years. And I did my master's from Delhi University in surgery, and I did my graduation from Punjab University, Chandigarh, Rohtak Medical College. So today's topic is piles, and in layman terms, piles are considered once someone has got bleeding from the rectum for any reason. And bleeding from the rectum can be because of many causes, but the commonest, which is according to common public belief, is taken as due to piles or hemorrhoids. One thing I want to mention here right in the beginning, that if the bleeding is due to piles, most of the times it is painless. And this is connected with the act of defecation, that is act of passing motion. And people who are constipated, those who strain a lot while passing stools, there the bleeding is more. The color of the blood in piles is always bright red. So this should be differentiated from other types of bleeding, which I will come a little later on. But the commonest cause of painless bleeding from the rectum is taken because of hemorrhoids, or we call them piles. Now, this is because of congestion of the veins in the anorectum, and they become swollen. And since they are full of blood, any injury, either because of stool or any other reason, ruptures the veins and the bleeding starts. Now, the piles can be of various grades. Now we are talking only of piles, the bleeding per rectum due to piles. Piles can be internal or external, or internal or external together with it. They may be prolapsing outside the rectum, or they may remain inside the rectum. Once they prolapse outside, it becomes painful, and they can cause swelling outside the rectum, a lot of pain. And if they get infected, it becomes a kind of emergency, which needs most of the time hospitalization. Now, as far as a personal patient perspective is concerned, normally patient does not go to the doctor for any advice for a long time. They go to the doctor only when the bleeding is severe, or it is going on for years together, or piles get complicated in the sense that they come out of the rectum, they refuse to go inside, they become prolapsed, they get infected. And that is a time that a patient consults a doctor. Now here, I will just spend a minute to tell you the other causes of bleeding from the rectum other than the hemorrhoids or piles. Bleeding can take place because of fissures, that is a crack in the anorectum, or it can take place because of inflammation of the intestines, or in some cases it can be because of some tumor or some carcinoma sitting in the large intestine. So these are various causes. So whenever a patient is confronted with hemorrhoids or bleeding from rectum, the clinician should always keep in mind that it may not be always piles, but it could be something else also. So this is what I would like to say. Now, as far as the management of hemorrhoids is concerned, most of the times after the problem themselves by taking some laxatives or putting some cream or something, which is they take it from Google or from their other friends, because Google has made a lot of people as doctors, and so that is why they do self treatment. They say internal. And because of that, the proper treatment or advice is most of the times delayed. So the various methods of treating hemorrhoids is that initial stages of hemorrhoids, you don't need much treatment. You can have some decongestants taken by mouth. You can take some vitamin C and avoid constipation, avoid staining on the stool. So first degree hemorrhoids will get cured of their own. Coming to the second degree hemorrhoids, that there are big hemorrhoids which may come out and they go back inside again. They are like a bunch of grapes inside the rectum. So there are various methods of treatment available for these hemorrhoids. You can give them sclerosing agents, that is to make them fibrosed, or you can do bending. That is a rubber band you put on the neck of the hemorrhoid and the hemorrhoid becomes dead after a few days. People have started doing stapling, which is quite an extensive surgical exercise, even though it is done through a endoscopic gun. And then the conventional treatment, hemorrhoidectomy. Now coming to grade 3 hemorrhoids, when you have outside hemorrhoids as well as inside hemorrhoids, or they are prolapsed already and they refuse to go in. In that case, after managing the initial infection, then you do hemorrhoidectomy by whatever method you use. Normally, hospital stays 2 to 3 nights. And after that, then if it is done thoroughly, properly, then that is the end of the story. So this is for hemorrhoids. Now the related problems with hemorrhoids which cause bleeding is a fissure in ano. Fissure means it is a crack, which can also happen because of constipation, because of horse riding or cycling or doing too much of gymming. So, hello? No, I'm in a webinar. So there is some discussion going on with corporates. So, मैं कर लूँगा. Sorry for the interruption. So, these fissures can also cause the bleeding, but they are painful. Then there can be, say, tumors in the rectum where the bleeding is painless, and that can be easily diagnosed by doing a endoscopy, either a lower endoscopy or maybe a full colonoscopy. All these things can be diagnosed and treated accordingly. So that is in a short manner the background about hemorrhoids or piles. So I will make a comment here that only the humans get piles. Animals don't get. And that is the price we pay for our erect posture. So that is the another thing about hemorrhoids. So now the discussions can take place. The talk is open for questions. No, once the hemorrhoids are treated, say there are normally 3 hemorrhoids at 3 o'clock, at 7 o'clock and 11 o'clock. These are primary hemorrhoids, and in between you can have secondary hemorrhoids also. But once they are treated properly, normally in 90-95% cases, you don't get piles again. But if you have done incomplete treatment or secondary hemorrhoids can crop up again, then you can get later in life some small bleeding again, and you may get recurrence of hemorrhoids, but that is very, very uncommon. Now this question that you are getting bleeding from your anal canal, I said already that all bleeding are not are not piles. One of the causes of bleeding from the rectum is piles. And what causes piles is, as I told you, that is the price we pay for erect posture and or chronic constipation, staining too much on the stools, and doing some heavy weightlifting, things like that, sitting for a long time or standing for long duties. All these things can cause piles. Now there are two questions. One is the treatment, the best treatment, and second is the pain. As I said before, that normally the piles are not painful. If you have pain, then you have maybe fissure, or you have got thrombosed hemorrhoids, they're lying outside the rectum, that causes pain, or there's an abscess, or there is pus formation, that is why you get pain. Otherwise, normally piles, when they stay inside the rectum, they don't cause pain. Now the best treatment. The best treatment is devised according to the expertise of the doctor and what he feels is the best for you. So depending on the nature of hemorrhoids, depending on the degree of hemorrhoids, you can devise the treatment. So thank you very much, ladies and gentlemen. And surgery, yes, is a cure for it. And as I told you, there are various modalities of treatment. So whatever is the best for you can be decided by the treating surgeon. So